Okay, well, welcome everyone. Good afternoon. We are very excited to have everyone with us today for our Age Well series presentation, which is going to be Aging in Place, Empowering Independence at Home. So my name is Jill Rankin. I'm the Executive Director for the Wisconsin Institute for Healthy Aging, or WIHA. And WIHA's mission, if you're not familiar with it, is to support health and well-being of all people as we age here in Wisconsin and also beyond. So we do this by disseminating evidence-based health promotion programs, excuse me, providing trainings to many organizations throughout the state and throughout the nation on health promotion education, as well as engaging and leading statewide public health initiatives and providing overall healthy aging information to the general public. So if you haven't already checked out our website, we encourage you to do so. We have lots of information on there. We have past Age Well series presentations, and so on and so forth. So lots of great public health information, health and wellness information, and overall aging information. So I'm happy to answer any questions afterwards. If anybody wants to get any more information about our organization or any of the resources that we offer. So if you haven't already, you can sign up for our Age Well newsletter that is on our website if you're not already getting that. And that provides a lot of really great health education information as well. So before we get started, just a couple little housekeeping items. We are going to have all participants muted during the presentation. We will have cameras off as well so that we can focus on our speaker. So if you have questions or comments during the presentation, we encourage that, and we encourage you to put those into the chat function on Zoom. So please submit any of those questions or comments, and then we will leave time at the end for some Q&A. So we will record this presentation as well, and an email will be sent to all registered participants with that recording on it after the presentation. So those are our logistics, and I am very excited to introduce you to our speaker. We have Nev Rumery with us, and she is going to be talking with us about aging in place. So hand it over to Nev.
Thank you so much, Jill. Thanks for the introduction. Let me get my screen shared quickly. Alrighty. Thanks again to Jill, and thank you all for being here. I am so excited to present on this today. Again, my topic is Aging in Place, Empowering Independence at Home. Here is a brief overview of our topics covered today. So I'll start with my quick background. We'll talk a little bit about occupational therapy. Then we'll get into aging in place, strategies to age in place. We'll talk about transitioning to a new home, and we'll end with some resources I've created. So let's get started. So my name is Nevaria Rummery, or Nev, and I'm an occupational therapy student. So I'm actually graduating a month from today after a lot of schooling with my doctorate of occupational therapy. And that was from Nova Southeastern University, and this is in Fort Lauderdale, Florida. So I had the chance to move to Florida for a few years, but I'm officially back to the Midwest, and I am so happy about it. So currently, to earn my doctorate, I am completing my capstone with the Wisconsin Institute for Healthy Aging, and it's been such a wonderful experience. I've gotten to learn more about what community-based work looks like and how I can continue to be involved during my career as an occupational therapist. So for my final capstone project, I have been focused on increasing education and awareness in topics surrounding aging in place. I've really always had a passion for working within the community and being able to work with lots of different groups of people, especially in areas of exercise, physical activity, and preventative health care. As for aging in place, I wanted to share how I became passionate about this topic. So my great-grandmother, who was amazing, she was extremely independent, strong-willed. She lived in a rural Missouri town and was a 45-minute drive from everything. I mean, the grocery store, her church, her friends, and she lived alone. So it was a little stressful to watch as my entire family lives in northern Illinois. So we didn't always know how safe she was being or how honest she was being about her health. And so this led me to realize the importance of sharing knowledge and educating others on aging in place because we as family members don't always have the final say, especially if our loved one wants to remain in their home. I mean, that's where they're comfortable, it's where they've lived for a while. And so that's what led me to this topic. And that's something I love about the Wisconsin Institute for Healthy Aging is they create workshops and materials with the rural living older adult in mind. And so I really appreciate that about them. So for my final capstone of my doctorate degree, I chose to further develop resources and education within aging in place to hopefully provide resources to someone that needs them. And so this presentation is a part of that. So I recognize that we're all here to learn about aging in place, but before we dive into that, I would love to take this opportunity to share more about my profession, occupational therapy. Another piece of my capstone is to spread awareness about occupational therapy, especially within the community setting. Unfortunately, there can be some misconceptions about occupational therapy. Some say we only work with the upper body. Some say we're the same as physical therapy. Some people think we help others get jobs because of occupation, but these are all false. So, occupational therapy is a health profession that focuses on helping people participate in meaningful activities, which we call occupations. This is everything one does from the moment they wake up to the moment they go to sleep. So it's like brushing your teeth, making yourself breakfast, driving yourself to appointments, or managing your household, and every other little thing you do throughout the day. We can work with a wide variety of people of any age and in many diverse settings, and that impacts the goals that we focus on. With adults, which is the area I plan to go into, we can see individuals in the hospital, outpatient clinics, rehabilitation centers, in their home, or in the community. Our goals mostly focus on increasing safety, participation, and fulfillment in our daily routines. So, although our sessions can look similar to physical therapy, we're each working on different goals with a very different lens. One of my favorite parts of this profession is that we view each client holistically or comprehensively and ensure our work is client-centered. So we look at all factors that could be impacting someone's wellness rather than just physical factors. Overall, the focus of occupational therapy is to ensure that our clients can do what they want to do and need to do during their everyday lives. So I'm so glad I can share a bit about occupational therapy because that's the lens we're looking at today when we're talking about aging in place. If you have any questions about occupational therapy, where we work, what we work on, please put them in the chat and I'd be more than happy to answer. But it is time to dive into aging in place. So I have a poll question to kick things off, and please answer the best definition of aging in place. It should pop up on your screen, and I'll give you a few seconds or minutes to do so. Thank you. I'll wait for a few more coming in. All right. I'm going to end the poll here, and you guys did amazing. So we got an A plus, and so you all are well versed in aging in place, which is such a great foundation for the presentation. So I'm so happy to see that. All right, so what is aging in place? So the definition from the CDC is, oops, it popped up again, but the correct answer was this is when one is planning to live safely and independently in their home and community as long as they can. Perfect. So from the CDC, they give the definition of the ability to live in one's own home and community safely, independently, and comfortably, regardless of age, income, or ability level. So I really appreciate that this definition includes the home and community, and that you can be at any age or ability level to participate in this concept. This includes being able to safely and comfortably live in your own home through various prevention strategies and planning ahead for the future. Typically, we see this as including home modifications. This could be like changing your bathtub to a walk-in shower, putting grab bars or handrails throughout the home, adding a ramp into the house, or doing small changes like cleaning up clutter so you have a decreased falls risk in the home. For our purpose today, we are going to delve into the occupational therapy perspective of aging in place by looking at it holistically, meaning all the parts and pieces. Some of those elements will lead to looking at one's identity, their sense of home or sense of belonging, community participation and access, social connections, and planning ahead or making decisions related to this topic. To successfully age in place, it's more than physical changes to the home. And so I hope that this presentation will give you some food for thought on these other elements related to aging in place to enhance you or your family members' preparedness to live at home. So, as we know, research is constantly evolving. And so, some researchers are recognizing that the term aging in place doesn't account for everyone's needs or wishes. And to address this, there are a few newly proposed terms coming up. Like I've seen aging in the community, but the term that has impacted me the most is aging in the right place. So, for our purposes today, this term closely aligns to our discussion in occupational therapy's perspective, since the decision on where to live is so individually based, and you can technically age in place no matter where you are living. So, aging in the right place is our theme for today. As we discuss about aging in place or potentially transitioning to a new home, this may be a topic that you are thinking about or that you're thinking about regarding your family members. And here's an important piece to remember, because this can be a sensitive topic. A house is so much more than just a physical place we live. It involves emotional, social, symbolic meanings that we've gathered over time. So, when we approach these conversations or you approach a personal reflection, we must remember all that goes into this decision is more than the physical barriers of a home, of a house. It's our home. It makes up a piece of who we are. So, just keep this in mind as you are considering a decision of where to age in place now and in the future. All right, let's talk about some data. So, the AARP conducted a survey in 2021. They determined that 77% of adults ages 50 and older hope to remain within their homes for as long as possible. This number isn't surprising since I'm sure most of us can relate to wanting to stay within our home. It's where we're comfortable, where we've made many memories, and a place we created as our own. What's interesting is a new poll that recently came out last month from the University of Michigan. They found that 87% of Michiganders 65 and older said it is likely they will stay in their current home for the rest of their lives. However, only 44% of them have actually taken steps towards preparing, like making home modifications or moving to a more age-friendly house, or both. And this highlights the need for increased resources and education on this topic, so more of us start to take steps towards successfully aging in place if that's a goal of yours. On that note, let's talk about some of the benefits of aging in place that are seen within the literature. Of course, we have the sense of home, our identity, feelings of belonging, and familiarity. We can feel so connected to our homes, and they truly stand as a piece of our identity and selves. This allows us to continue our sense of belonging and comfortability in our homes, staying in the same home you've been in. Living at home means having more control over daily activities. We are able to continue meaningful daily routines that we've established over time. And you're living on your time only, especially within retirement. This may make it scary to move somewhere new and then feel like you're losing a sense of control or a level of independence. Remaining in your same home can make it easier to continue your established social connections or relationships. And that can be with neighbors, friends, and family. But being in your same location, you can continue those routines of seeing them. And finally, it can be more cost effective or affordable to stay in your current home than move somewhere else. Overall, these benefits may make aging in place sound perfect, but I want to mention that these benefits are not the case for everyone. So if you're not relating to these, you're not alone. These are just what's mentioned in the research. Everyone is different and everyone's needs are different. So it's so important to take the information from today and reflect on you or your family's individual needs. Moving ahead, we are going to go through each of these 6 list items on what is necessary to age in place successfully. And these are mostly outlined by the National Institute on Aging, with an addition of maintaining overall wellness from other literature. Number 1, plan ahead. So this isn't number 1 by accident. Planning ahead is an integral piece of aging in place. This means planning ahead proactively before something happens and planning continuously, which is like regularly discussing with family or regularly reflecting individually. This also is important for everyone of all ages. So if you're a first-time home buyer or you're looking for your forever home, you may want to consider if it's an age-friendly house or what it would look like to stay in that house forever or have a family member move in. That's considering things like, is there a full bathroom and bedroom on the main floor? Is there a no-step entry into the home? Or how wide are the doorways? And you could also ask your realtor to help you recognize these things as well if you're house hunting. The other thing about planning is that it allows you to share your thoughts and desires about where you live. If something happens and your family is forced to make a decision on your behalf, you want them to have some idea of your wishes and desires. And on the other side of things, you want to be aware of your family members' wishes so you can make the right decision if needed. Some strategies listed here include having regular family meetings, which allows the conversation to feel more comfortable, discussing with your physician or healthcare provider on your needs and their thoughts, or using a tool from the research called Plan Your Lifespan. The Plan Your Lifespan tool is a website that walks you through topics and decisions that you may want to consider regarding aging in place. You can create an account and then you can save your answers, which allows you to revisit the tool every so often to update your answers based on your current self, since we're always growing. This can be a great tool to use during discussions with your family or healthcare provider because it helps walk you through each decision and some that you might not have even thought about yet. So the link is on the slide, and when we post the presentation afterwards, you should be able to click on it, but otherwise this one is planyourlifespan.org. Number 2, identify need for support. Here's where you can consider what types of supports there are while living at home and aging in place. It doesn't mean you need them now, maybe you do, but it's important to educate yourself and learn what's in the community so you're prepared for any changes that come your way. You can still live independently, but ask for help when you need it. And that can include help in areas like personal care, dressing and bathing, household tasks, which is like cooking and cleaning. This could be in medication management or transportation to appointments. Listed here compares home-based care to a respite care provider. So home-based care is a skilled healthcare professional, whereas a respite care provider is someone who's trained, but they're not necessarily a healthcare professional. So knowing the difference can help in conversations with your doctor and just you planning ahead for your needs. There are also meal services available. So if you're finding that cooking is being a bit too much or you're not having full nutritional meals, you can explore some meal services in your community like Mom's Meals or Meals on Wheels. Or you could create a plan with a family member and they could help you with yard work, household tasks, or making meals. It's important to recognize what's out there. Even if you don't need it now, knowledge is power, so you can learn of resources in your area that could help you or someone also living in your home enhance their well-being. To safely and successfully age in place, making home modifications or changes is a necessity so that your home is physically safe. This is important to prevent falls, reduce injury, and overall improve your mobility and completing daily activities in your home. This can be easy changes like adding nightlights in the bathroom so you can see the walking path, or they can be more intense changes, like switching your bathtub to a walk-in shower or adding a chairlift to the stairs. Today, we are not going to specifically go into each of these changes because we had a previous Age Well series presentation on each of these changes to make room by room back in September, and the recording's still on the website. That was led by an occupational therapist, Dr. Beth Fields, and she gave great suggestions for changes to make to your home so that it's safer. So I highly recommend watching her video and checking out that resource. So the link is on the slide, and again, you can click on it when we post the slides later. Along with that, towards the end of the presentation today, I will discuss a home self checklist that I worked to create that kind of goes along with this as well, going room by room. Another great resource related to home safety is on our Falls Free Wisconsin website. So here you can go through this virtual tour and learn of changes that should be made to the home to make it safe for fall prevention, and it works for aging in place as well. So if we have time at the end, we can go through this website together. Otherwise, the link is on the screen. Moving on with our necessities to age in place, our next strategy includes learning about our community resources and sharing with others who may benefit. This includes being prepared for medical emergencies, like having a plan of who to call, writing the number where you can easily see it, keep your phone on your person at all times, have an emergency medical care button, or a smartwatch can be helpful too. All in all, just being prepared at any moment in case you need to contact someone. This also includes learning about your community workshops like falls prevention, social connection, or health promotion to increase your overall wellness. And be sure to check out your local Aging and Disability Resource Center, ADRC, or area agencies on aging, as they have numerous resources to benefit you. And finally, discovering what public transportation's options are available in your community, which can help get you to appointments, the grocery store, or any of these different resources. Again, if you don't feel like you would benefit from these now, that's okay. It's just important to educate yourself and know what's available in your community to continue to thrive. As we know, home modifications are not free. So knowing the cost of what you're planning on doing to safely age in place is important when looking ahead. According to US News in 2024, they stated the national average for age-in-place renovations ranges from $3,000 to $15,000. There's such a large range since every home is different, and some need more changes than others to be considered age-friendly. However, it's important to keep this in mind when planning ahead to age in place. So knowing what type of home you live in makes a difference. Like, does it have a lot of stairs or a lot of different flooring changes? Does it only have bathtubs? Does it have slim hallways or doorways? It's just important to consider these points. The other piece is that renovations take time, and it can be very frustrating to have your bathroom under construction for any amount of time, especially if you only have one full bathroom in the house. So planning ahead is huge there. And finally, it's recommended to explore other available options, especially when comparing the financial cost. This includes learning the cost of local, independent, or assisted living facilities, and it's important when choosing your preferred location. Also learning about things like lawn care, snow removal, meal delivery, all the prices of everything, just so you can get a full picture of the cost of aging in place while you're planning ahead for your needs. Our sixth and final piece to successfully aging in place is maintaining your overall wellness, and this includes physical, mental, and social wellness. So we need to remain physically active, and this could be through community exercise groups or walking with neighbors. We also should continue to participate in meaningful leisure activities. And these could be activities that you've always loved, or you can try something new. But whatever we do for leisure makes up a huge part of our identity. So it's important to explore this area and ensure you're finding activities that make you feel like you. Maintaining strong social connections is extremely important. This can help reduce feelings of loneliness or being isolated. So meeting up with family, friends, and neighbors regularly is important. And being involved with your community. This could be through volunteering, participating in community events, or attending a spiritual event. And these are always extremely fulfilling to many people. So we must continue these as we're aging in place. It really is more than just living at home, it's also living within your community. So now that we've gone over the benefits of aging in place and what's necessary to do so successfully, we have to recognize that not one solution fits all, and aging in place isn't perfect. If you take the time to plan ahead and you prepare yourself in your home, you can avoid some of these cons. However, everyone's different, so similar to the benefits that we mentioned earlier, we must recognize our own individual needs. So listed here are some commonly discussed cons to aging in place. The first is that when we age in place, we have to be physically safe in the home. If not, we're at risk for injury. So that could be when we're at risk of a high risk for falling, or if we need assistance to manage medications, just making sure you're physically safe living independently at home. Another main con is that some feel they have decreased social connection in their home. And this can be more common in rural areas, but we can have a higher risk for isolation, higher risk for feeling a sense of loneliness, and having reduced social opportunities or awareness of social opportunities. As we've already discussed, the home modifications for aging in place can be a financial burden, and they may not be completely feasible in our homes, just depending on the layout, like the amount of stairs you have or the entrance to get in. Finally, taking care of one's home takes work, and that includes yard maintenance, snow removal, cleaning the house, regular house maintenance like changing light bulbs, all of those things. So we can potentially hire individuals to help, but that also costs money. So it just must be factored into our idea of finances for aging in place. So although aging in place sounds ideal, it may not be the best for everyone. So we're going to talk about what that may look like. All right, I have another poll question for you. So have you ever discussed with family members or close friends about moving to a new home for safety? Thank you. I'm just letting more answers kind of roll in. I'll give us like 15 more seconds. All right, I'm going to end the poll and share the results with you all. All right, so we have across the board, which is great to see. So some people have talked about it with a family member or friend. Some have had a family member or friend ask them, not yet, but I plan to, and some nevers. So across the board, I love the diversity. Okay. So deciding when it's time to relocate. So this is the point when you've been reflecting on your living situation and you begin to consider the idea of moving somewhere else. To confidently make this decision, it's important to begin having regular meetings with family, friends, or healthcare providers to talk about where you're currently at and then a plan if anything changes. This allows everyone to begin to feel comfortable discussing and sharing their thoughts. Next, we have to be honest and realistic with ourselves and with others, which can be difficult, but weighing the pros and cons of each living situation honestly and listening to family or others as they may share a perspective that we hadn't considered yet. It's important to always approach conversations with others with kindness, patience, and understanding. And hopefully, everyone's speaking out of love and with the best interest of everyone in mind. And finally, the last step is acceptance. So, officially accepting that it may be time to transition to a new living situation. I wanted to highlight some common reasons why people may relocate to either independent or assisted living facilities. One major reason is having a high frequency of falls or developing a fear of falling. And this can keep someone from participating in their meaningful activities. Related to frequent falling is vestibular dysfunction, and this is a topic that I explored during my capstone, so I wanted to share a bit about it. The vestibular system is located in our inner ears, and the structures here detect the information, send it to the balance system in the brain. If one of the information systems is not working or it's damaged, the brain may not receive enough information for the balance system to function properly. This can impact your ability to participate in daily activities in your home and community and safely age in place. So, as part of my capstone, I created some resources related to this, which can be helpful if you tend to feel dizzy, lightheaded, or experience vertigo. And I highly recommend discussing with your physician these symptoms to see if you could benefit from vestibular rehabilitation. So, those resources will be posted on the Wisconsin Institute of Healthy Aging website that you can review later. Moving ahead, a couple other reasons why people relocate include having less responsibilities of house maintenance, which we've talked about, and relocating can assist in having more social opportunities and activities with others. It also can allow you to receive assistance with daily activities if needed. All right, everyone, we are now switching gears and we're going to explore what transitioning to a new home may look like. So, what is transitional care? This includes preparations of the logistics of the move, education of whoever is moving and their families, and ideally, it would have a healthcare provider involved in the coordination. It's also important for the individual moving and their family to recognize that transitioning to a new home can significantly affect one's identity. It also may impact their level of control over daily activities, their daily routine, social status, change in leisure activities, and it can sometimes feel even like a trauma or a loss. However, by proactively preparing for this transition, this can reduce these negative feelings and lead to a more positive experience. By engaging in leisure activities, creating a sense of home, and either continuing or rediscovering one's identity, these all lead to a positive experience when moving to a new residence. So I don't want to spend too much time here, but I do recommend learning the difference between independent and assisted living facilities and what amenities are available at either. And it's important to explore specific places in your community because they can differ in amenities included, and it allows you to be better educated and prepared for anything. So, independent living, you continue most of your independence because you still manage a private residence, all your self-care tasks and cooking, but you don't have to worry about yard maintenance, snow removal, and the layout will be more accessible and age-friendly. And you may have more opportunities for social connection with others. Assisted living is where there are trained healthcare providers available for assistance with daily tasks and on-site medical professionals to help with your needs. This also creates opportunities for exploring leisure activities and connecting socially with others. Again, each facility may have differences, so I definitely encourage you to explore what's in your area and learn more about what they offer to their residents. Since we discussed the pros and cons of aging in place in one's current home, let's talk about what the benefits are for moving to an independent or an assisted living facility. There are other options, of course, like moving in with family or other things in your area, but for the sake of argument, we're going to specifically consider these two. So one of the best parts is that these places are already accessible with an age-friendly design, and they have more manageable spaces, which is nice if one's home is starting to feel too large for them. These places provide maintenance-free living, so you don't have to worry about lawn care, snow removal, any regular household repairs. Another benefit is the opportunities for social engagement, which makes for a close social community with others during social activities. Research tells us that by being surrounded by others at similar life stages, it actually increases your social participation. There are amenities included like dining services, transportation, and access to healthcare. And finally, many individuals say that this provides them a peace of mind in terms of safety, emergency response, and someone to be there if you needed help. These benefits are definitely worth considering as you're regularly thinking about aging in place or relocating to a new home. Transitioning to a new home. So, this can be a very exciting time and a new time. However, it may come with some fear for the change and what's to come. These transitions, if not properly done, can lead to a sudden change in identity, daily routine, leisure participation, and level of independence. From an occupational therapy perspective, our daily activities or occupations are what provides us our purpose, meaning, and daily structure, which are all key pieces to our identity. Researchers from this study, Gravanek and colleagues, tell us that a positive pre-transition phase can decrease negative outcomes like grief, loneliness, and even falls. And it can help you maintain your identity and purpose. So it's important to think ahead and plan for the transition to maintain your wellness during that time. Let's discuss what the three main phases of transitioning to a new home may look like. We have pre, mid, and post transition phases. So during the pre transition phase, this is before you've decided where you're going to live. During this phase, it's important to seek out all the information you can on what the process may look like, finances, and various places in your community. Also important to express your emotions and anxieties honestly to others and really take the time to explore the right placement. So, going on visits, looking at websites or videos, and talking to others. During the mid transition phase is when you have decided you are going to move and you know where you're going to move, and you're in the middle of getting ready to do so. So, this period is when you should really look at your daily routine and reflect on what you enjoy about that and how you can still do something similar in your new home. You can formally introduce yourself to your new neighbors. You can find what items in your home make it feel like home and feel like you, and how you can add them into your new place. And definitely take more time than you think to pack, organize your things, and get ready for the big move. The final transition phase is post transition, so immediately after you move to your new home. During this time, you explore what you prefer to do in your daily routine. You communicate your feelings and experience with others, especially your neighbors that have gone through it. Keep in regular contact with friends and family through phone calls, visits, and take time to reestablish your set routines and really explore what you enjoy. All right, another poll question. What are some things one can do to improve their experience after transitioning to a new residence? And this is you can select multiple. So click as many as you think. I'll give us like 10 more seconds to answer. All right, I'm gonna end the poll and I'll share the results. All right, so our correct answers here are exercise, checking in with friends, trying a new hobby, and setting out meaningful items in your new residence. Sitting and watching TV is great in small doses, but shouldn't be a main strategy during times of transitioning to a new home or working on increasing your feelings of wellness. And I love to see that no one selected there's nothing you can do because there are so many active strategies you can do, and we're going to go through them next. So thank you for answering. All right, let's go over what are things you can do to prepare for and cope with the transition to a new home. Continue to participate in physical and mental activities like exercise, walking, puzzles, and reading. Ensure to remain connected to the outside world through visitors, sending mail, and placing meaningful possessions in your new home. Find an updated routine and rhythm to your day that is filled with your longtime hobbies or new ones. And take time to collaborate with others on the things you like to do, like playing cards or walking. And this goes along closely with participating in social events. It may feel easy to stay home, but by spending time with others and relating to them, you may quickly find that sense of belonging. And finally, it's highly recommended to find spiritual or volunteer activities, which both significantly add to one's identity and their feeling of purpose. These all promote adjustment and a positive perception of one's new home. Passive strategies. So these are things that may not necessarily be within your control if you're the one that's moved, but it's important for us to recognize them if there's anything we can do to increase them. The first is finding peer support from others that live there. So this can really help solidify one's sense of belonging and their sense of home. So on the other side of things, if you find yourself in a place where you can help support a new person to the community, always be welcoming and support whatever they need. Many individuals found that staff support was integral to making it feel like home. So for us, this can be like taking the extra step to make connections with staff, and hopefully they'll be supportive, but it's not necessarily within our control. And finally, others found that by having an already set familiarity with the place or with some of the residents made a big difference on their comfortability and their sense of home. So we can take this as before you have to move, exploring what's in the community and chatting with some friends that have transitioned to a new home to learn about their experience. We are getting towards the end of the presentation, and I'm so appreciative of your attention. So if you're feeling like you want to take action after learning from this presentation, here are a couple of options. The first is by seeking a professional to provide an evaluation of your home and its readiness for aging in place. You can do so by checking out the Certified Aging in Place Specialists or CAPS in your area, or by looking for age in place companies near you. I've created a document of how to find the certified aging in place specialists and age in place companies near you within Wisconsin, as well as home repair funding sources to explore. Another option is finding a self checklist that you can complete on your own home if you're not able to find a professional. So I've also created one of those based on the research, which I'll share in just a few slides. Again, these documents, as well as the others I'll show, will be accessed from the Wisconsin Institute for Healthy Aging website under the Age Well series. And so that should be updated once we can post the recording of this presentation. All right, so here is a list of local and other resources related to aging in place information. These can help you get a home safety assessment or explore more resources within your community. This list includes resources throughout the state, and it's a mix of businesses, community initiatives, and other resources. I broke it up into specific places or businesses, funding resources for home repairs or modifications, and then general community resources available throughout the state that you can explore. So the link to the site is on this slide. I also compiled research and I created an age in place home checklist. This is a checklist going room by room or category by category, and it describes what you should consider in each category to make you and your home ready for aging in place. If you go through this list and you decide what needs to be done, it can help you plan your finances or your timeline of home modifications. It can also be broken down. So, for example, every spring cleaning or each season, you can decide to focus on 1 to 2 categories and slowly prepare for aging safely in your home because it's never too early to start. Also included on the website will be some other resources I've created. This includes aging in place with dementia, which can be really beneficial for the individual to remain in a familiar home environment. And there's some different strategies on it that we didn't go over today. Vestibular dysfunction, and that's like when you should talk to your doctor, what vestibular rehabilitation looks like, because it can be different based on what you have. And then some general aging in place documents that include the information we talked about today. So you can refer back to them if you're thinking about this topic, or you can share them with others to share what you've learned. All right, we've made it to the key takeaways. So, number one is that it is never too early to start thinking about and planning for aging in place. This can be from when you're first buying a home or when you're looking into a forever home. Number two is that there are things that we can actively do to prepare ourselves and our homes for whatever is to come. Number three, aging in place is not the only option, even if it feels that way. Transitioning to a new place is another option. And it's important to consider these options as you're thinking ahead, discussing them with others like friends, family, and your healthcare provider. And finally, number four, you are in control of your wellness. Implement the active strategies we talked about if you are ever transitioning to a new home. And this will help you maintain or discover your identity and thrive. Thank you so much for attending and listening to this presentation. And I also want to give a big thank you to the WeHa team for being so supportive of my project the past few months. I'm so thankful for my time here.
Great. We are going to get to questions and answers with Nev shortly, but just going to share briefly here. Please, when you exit out of Zoom today, you're going to be asked to take a brief survey for provide some feedback. So if you do that and you'd like to win or enter to win an Age Well t-shirt, you will be entered then, and then we'll be drawing for that later this week. So be sure to do that. And then the upcoming Age Well series, we have Volunteering for a Better You, Purpose, Connection, and Growth on August 27th from 1 to 2 p.m. And then Denying Gravity, which it will be a live film screening. This Age Well series event will not be recorded. So if you're interested in this, please make sure that you are attending that live. And that will be taking place on September 9th. So we encourage and hope to see all of you there. And I will turn it back over to Nev for Q&A.
Thank you. So yeah, feel free. You can say a question out loud or type it in the chat. Anything that we talked about today, more than happy to answer. Or any of the resources I talked about, I can pull up too.
Now, do you maybe want to walk people through the home safety challenge?
Yeah, let me call on Janet
Janet,
quick. Let's
yeah,
do that.
Janet has a question for you.
Great.
Good afternoon, and thank you for a wonderful presentation. I'm just curious about the research you did on certified aging professional or specialists. Are there many in Wisconsin, and are they geographically dispersed, or like I feel like there aren't very many of them, despite the fact that's been around for a while?
Yeah, unfortunately, you're correct about that. There are not many in Wisconsin, and especially not like occupational therapists or physical therapists. So I created that sheet of other resources because I was hopeful that there would be a lot of certified aging in place specialists. And since there were not, that's why I created all the different resources, and hopefully those are helpful as well.
Thank you. Do you know if that's unusual? Like, do other states have more available?
I would need to look because I really only was looking at Wisconsin, so I'm not
Sure.
positive, but that's a great question I'm curious about as well.
Thank you.
Yeah, thank you. So Kathleen, I see, said, I'm having trouble finding a handyman. Do you have any suggestions for finding someone? I would recommend maybe talking to your ADRC or Aging and Disability Resource Center, and they would maybe have some suggestions. Otherwise, I don't know if I have a great suggestion for a handyman, but I would start there and see, especially if they have background in like age-friendly homes. Okay, Nancy said, assuming you can't promote specific med alert companies, but can you speak generally to what's best to encourage a mom aging in place in a two-story home? So do you mean specifically related to like a medical alert? system, like a fall device. Let me think. I think just sharing this information with her and setting up, yeah, I don't have any specific medical alert companies, but I think setting up a fall device of some kind. I know some people have talked about using like an Alexa system or like a Google Home where they can shout out and say something too. That can be helpful in different rooms. Otherwise, yeah, I also mentioned the smartwatch. I don't know if you're interested in that, but then that's always on their arm and can be something that's less, doesn't feel like a medical alert device, feels more like a watch. So that's my answer for that. I'm sorry if it wasn't perfect. Okay, great. Okay, well, I can pull up the home safety assessment from Falls Free, Wisconsin. Erin, do you think do that now?
Yeah, I don't see any other questions coming in.
Oh no, did I? I must have, oh, here it is, because it was full screen. All right. Alrighty, so here is the Falls Free Wisconsin website, and you'll go to the Home Safety Challenge. And so it talks about the Home Safety Challenge. And when you start it, it'll kind of move through each room in the house, and you can click on different things that you think would be a hazard. So for example, here I would click on the dog because maybe they're running around your feet and causing a falls risk. Also, the rug, it looks like it could be slippery and it's kind of out of place. So you can go through each of the rooms in the house, and it's really beneficial to learn about. I mean, some things you sometimes would never think of. And then there's like, you could add this here. So it might not be a hazard, but since there's a lack of a grab bar, that's where it's like you should add a grab bar here. So you can go through and there's 59 hazards. I tried it and missed a lot of them. So I had to go back and see what I missed. And so it was really beneficial to learn from that.
Do you want to click on the Get Started button just so people see what that's like live?
Yeah. Awesome. So we start on the front porch and you can see things kind of light up as you're going through. So missing the railing on both sides of the steps. See what the stairs say. Too steep, or they could be cracked. Having them repaired as soon as possible. Sometimes you can cheat and see what lights up. So overhang at the entrance or exit is helpful to protect from the rain, snow, and sun. So it gives hazards and positives. I'm seeing this cord here. Plants, gardening items, clutter. So removing the clutter from the walkway and steps, decrease the falls risk. We'll move ahead and see what's in the house here. All right, I'm seeing lots. I don't know if you guys are, so let's see. Clutter, first thing is I saw. Removing them so you have better walkways, less risk to cause a trip. Throw rugs on smooth floor, and they can have turned up edges, which sometimes your feet or your cane or walker can catch on.
Great. There is another question in the chat.
Thank you. Sally said, do you have any thoughts about a hybrid of aging in place in individual accessible cottages within a community setting of perhaps 30 rental cottages that use a residential manager? I mean, I think that would be a great idea, especially if they're age friendly. So yeah, you said they're accessible cottages, and then it provides that community setting in a place where you can age for a while in that home. So I think that would be a great idea. And a residential manager. Yeah. I feel like that's where we should be going in our living situations. So that was a great idea, Sally. Any other questions? I'll just click through some of the documents that I pulled up since they're pulled up. But so this is the local Wisconsin resources list. So again, some of them are businesses, some of them are like community initiatives. And I tried to list where they're located, and some of them do travel. So like for this home safety innovations, they'll travel within a 120-mile radius, which is almost the whole state. Madison, Appleton. But yeah, I think reaching out and seeing if they'll travel is really beneficial. This one lists a bunch of counties. And then I tried to list some home repair resources. So you can reach out to them and see if you're able to get any financial help to do any home modifications or home repairs, like we just saw with those cracked front porch steps. They could hopefully help you repair them. So these are some resources here. And then the others I listed are just kind of generic ones that you can look at. The Age Safe America one, you can sign up and then they will reach out to you with specific information that meets your needs. And then the first one is the Certified Aging in Place Specialists, and then the Aging and Disability Resource Centers. So that is our list of resources. Here is the checklist I created. So it goes room by room. So you'd kind of go through the bathroom. Do you have a tub that you have to step over? Possibly putting a shower chair or bench. Changing the shower head so that it's removable so that you can sit while you're showering too. Just some examples there. Looking at the bedroom, you could potentially move your bedroom downstairs if possible, so you don't have to go up the stairs to get to your room. Bed risers if needed, a bed handrail, which can be helpful when pulling yourself up to a seated position. In the kitchen, I definitely like the one of checking for spoiled food because whenever I go to my grandma's, I definitely take that job. So it's so important to do. And having items in an easy to reach spot so that can keep you from picking up really heavy pots. Even when picking up heavy pots from a low, that could still be a risk for hurting yourself or falling. So keeping them on an easy to reach place. So it goes over furniture, flooring and rugs, the doors, swapping your doorknobs for lever handles, which are easier on joints. The stairs, entryways.
So all of these documents will be included when we send out the recording as well. And that should be coming later this week.
Thank you all so much for being here. I really appreciate it.
Thank you, Nav. Great job. Take care, everyone.
Hi, thank you.
Thank you.
Thank you.